team form our team Placebo. We are the students of Parul University. I am one of the team member, myself Preksha Patel.
And myself Nishank Bhagat.
And myself Zainab Nalawala.
And we are going to present on implication of population growth in India now and in the future.
Increasing urbanization poses both challenges and opportunities for India, with the urban population projected to double in next 25 years. The associated issues include public health, mental health, housing and sanitization. To tackle this, India needs policies for sustainable development, improved education, healthcare access, job creation and environmental conservation. Implementing family planning and population control program could be aid in managing future growth. The denser the population growth, easier it for infectious disease to spread and chronic disease to prevent. Overpopulation leads to environmental changes and urban crowding, which results in emergence and transmission of communicable disease. Impacts of overpopulation on public health. First, increased risk of infectious disease caused viral and bacterial infection. Second, due to lack of sanitization, it will cause disease like dengue, chikungunya and malaria. Third, water contaminated disease can cause like typhoid, diarrhea, cholera, etc. Fourth, respiratory disease like asthma, COPD, cardiovascular disease can be caused due to environmental air pollution. Strategies to overcome impacts of overpopulation on public health. First, health-related initiative. It includes Swachh Bharat Abhiyan for prevention of communicable disease and to improve hygiene and sanitization. Then, Pradhan Mantri Ujjwal Yojana, which provides all women gas cylinder, which helps them to prevent respiratory disease. And the Integrated Child Service Scheme provides vaccination to all child from the time they born. Second, family planning. Promotion of contraception, reproductive health service, birth control technique by government, NGOs, private charitable trust, civil society to keep population in limit. Third, education and empowerment. Educating women and men about family planning, disease condition and prevention. Empowering girls and women to adopt healthy lifestyle, hygiene and sanitation to prevent chronic disease. Fourth, disease prevention. It includes primary and secondary prevention. Primary prevention focus on eliminating risk factor and measures to decrease disease occurrence. And secondary prevention focus on early detection and treatment. Fifth, healthy lifestyle. Be physically active, eat a well-balanced diet, don't smoke or drink. If you do, quit it. And prevent STI and HIV or AIDS using birth control methods. 6. Screening. Screening is a medical approach to health promotion that aims to identify specific condition in a targeted group.
Now, I am going to address one more challenge, which is mental health. A report by WHO has enumerated that mental disorders account for 12% of the global burden of disease. By 2020, this will account for nearly 15%. Overpopulation can have a significant impact on people's psychological well-being in number of ways. Number one is stress and anxiety. This can be due to people feel a lack of personal space and privacy. This can lead to feeling of tension, irritability and frustration. Second is aggression and violence. This can be due to increased competition of resources as well as stress and tension caused by overcrowding. Third is social isolation. People may feel overwhelmed by the sheer number of people around them. This can lead to a sense of loneliness and disconnect from others. Fourth is environment degradation. It can have a negative psychological effects on individuals and communities. Example, pollution and deforestation. Urbanization is associated with increase in mental disorders such as depression, substance abuse, crime, family disintegration, alcoholism, etc. I am going to talk about strategies to overcome mental health. First is providing access to mental health services. Second, providing community engagement and social support. This can help individuals feel more connected and less isolated in crowded environments. Third is investing in infrastructure and resources. Government can invest in infrastructure and resources, which is housing, water and sanitization facilities. Then fourth is there is a need to create awareness about mental illness across all sections of the society, which will act as a facilitator of change in growing Indian economy. Fifth is reduce structural stigma towards people with mental illness and members of other social groups. And last, primary care provider need to be knowledgeable of the socio-economic determinants of poor health such as death or unemployment.
Next challenging aspect for the population growth is housing and sanitization. Now the UN Habitat has given certain criteria for household, that is permanent house, then sufficient living space depending on how many people are living into the room, then access to clean water easily, and access to sanitization, that either it can be private washroom or a public washroom. Now according to the criteria given by the UN Habitat, the census has provided data on which type of house should be made. Either it should be made of wood, iron, cement, etc. Then the type of roof that should be made, then the lighting source, then the source of drinking water, distance from the source of drinking water to the household, type of sewage system, type of drainage system, and other common aspects which is required to make the household sufficient enough so that any communicable disease cannot happen to the people living into that slum areas. Now the strategies for controlling the sanitization and proper housing requirements are: first, we should not force the people living in the slum areas to move into urbanization. In situ upgrading approaches should be done. Then the municipal who are doing the upgrading process into the slum areas, they should properly manage it from time to time. Then quality of water should be given to the people living in the slum areas, because water is the most common source for spreading of any communicable disease. Time to time cleanage of the waste products which are actually dumped into the people living on those areas. Then second, then counseling sessions should be provided to the people living in the slum areas. That is, proper education should be given, especially for women who have menstrual cycles, and to the children who like infectious diseases that can be spread, or geriatric diseases which are more common. That should be counseling sessions should be done. Then well-designed sewage system should be done which reduces the mobility and mortality cases which can be spread through fecal-oral transmission. Then providement of the hygiene kits, which includes the pads, then sanitary napkins are there, then other soaps and hygiene kits are there that should be provided to the people living into the slum area.
From the report, we can conclude that implication of a population growth in India, both in present and future, are multifaceted. As a world-populated country, India faces these challenges in providing adequate healthcare and sanitation services. Overcrowding, limited resources, and unequal access to the healthcare facilities poses obstacles to the public health. Communicable disease spreads easily. Inadequate shelter and exposed living conditions can make individuals more vulnerable to the vector-borne diseases like malaria, dengue fever, and Zika viruses. Indian population surge has significant emotional and psychological impact on individuals and society as a whole, contributing to the mental conditions like anxiety and depression. To overcome this, improved health reduces incidence of disease and increase life expectancy. The responsibility for restoring and maintaining an effective public health system should not fall solely on the shoulder of a public health professional or a government. Instead, it is a shared responsibility and support of the entire Indian population. All countries must take immediate steps to control and manage human population growth. It exerts immense pressure on limited resources, leading to the scarcity and unequal distribution of resources. Ultimately, by working together to address the emotional and psychological challenges of India population surge, we can build a more resilient and prosperous society for all.